Hello. Hi everyone. I'm just gonna Hello. Hey, how are you, Shiv? Alright, that's nice. A few people are joining. I'm happy that you are. I was meant to go live with the talk you never got, but apparently they're having some kind of internet issue and they're not able to connect at this point. So I thought I will just join and see how many people are actually joining, and I probably can talk with you guys. And if you guys have any questions, just pop it in and I'm happy to answer it. And I know I always keep talking about sexual health and safe sex, and a whole bunch of other things. So just to brief off, saying I'm Dr. Nivi, I live in Sydney, and I am a dermatologist and a venereologist from Chennai, and I practice sexual and reproductive health in Sydney, and my main interest is educating people, and especially young and vulnerable people, about what a healthy sexual health is, what healthy sexual life can be, and a whole bunch of other things. So it's been an absolute pleasure being on Instagram for the last few months, and I've enjoyed all of you actually joining me. So that's really great. Hi, hello. Hi, everyone. If you have any questions, pop it in. This is the first time I'm doing a live on my own. It's so nice to see so many of you join me. It's an absolute pleasure. I'm just going to start off with some basic things that I always tell people. So sex is always not about, sex is always not about penetrative sex. And I always tell people there's a whole bunch of things associated with sex. So it definitely starts off with liking for or wanting to actually do it. And the second important thing with sex is consent. Both parties involved, or even more than two parties involved, need to be accepting of wanting to have the sex at that point. So consent is a very, very important thing. The third thing is, I think, contraception. Contraception is, again, very important if you're not ready to be a parent at that point in time. So that's, again, a very important part of sexual health. And the next thing is condoms. Condoms are great because not only because they're great contraception, but also because they are fantastic for protecting you against STIs. So let me just tell you here, STIs are kind of the last and the most important part of sexual health, but they are not actually the only important bit of sexual health. So so I think those are the very important elements of sexual health as a whole. Hi Lila, thanks for joining. And yeah, so that's that. And I also always talk about some myths that people commonly have in sexual health, right? And they're very, very important. And it's funny because I see it all the time and we just come back over and over again. So the first thing I always hear is, I'm not that kind of a person and I won't get an STI. I don't think STIs actually discriminate from what kind of a person you are or not. So the basic line of having STI is whether you have having sex or not. So if you are, definitely you're going to get an STI. Somebody's asking me if I know Hindi. I do, but I don't think I'm very fluent at it. I think grammatically I might not be very correct. But yeah, I do know Hindi. I understand Hindi, definitely. And hello, Hema. Yep. Sorry, I was saying that, so that's a very common myth that people think that they are not the one that's going to get an STI. And the second thing I hear always from people is to say, I don't have any symptoms. Why do you think I have an STI? So I don't think, I don't think it's definitely about having a, sorry, give me a second, guys. Perfect. I have sent a request to Talk You Never Got. That's the person that I was going to have a conversation with. There she is. Hello.
Hi. I'm so sorry about that.
No,
network.
It's all right. It's
Not
all right.
work.
It's okay, Karishma. I took over your job and I was trying to do this live on my own. It is quite nerve-wracking. I don't know how you guys do it.
No, thank you so much for waiting and being so patient.
It's so nice that so many people have actually joined us. I was all excited.
I know. I'm really excited as well. So I just want to start with saying this is my first ever live. So I'm really excited to share. Yeah.
So good. So you're in no better position than I am. So it's great. Let's go for it.
So I want to start with introducing you to viewers who might not have met you before. So hey everyone, this is Dr.NivedithaManokaran. She is a dermatologist and a venereologist from Sydney. Well, from India, but working in Sydney. And she was trained by Family Planning in Australia. She works in sexual and reproductive health as a clinician. And she's really passionate about women's health issues as well as youth reproductive health. And also, just like a lot of us here, she never received a lot of these conversations when she was young and when she was training as a young doctor. And so you could say that it's the talk she never got.
That's right.
Yeah, and that's what she's here for today. And we're super excited to talk about STIs today. And I'm just gonna super quick introduce the topic and then hand over a million questions that I have for her. And please keep asking questions that you have as well in the comments. So today we want to talk about STIs because we're living in a time where virus transmission is a daily dinner table conversation. And I think that we have only been talking about one virus, but it's really, really important that we talk about a bunch of other things that also affect us, and especially the viruses as well as bacteria that affect our sexual and reproductive health. And I think it's really important to have this conversation today because there's also so much stigma attached with this topic. And given that our special guest here is an expert on this, I'm really, really excited to hear her point of view. So hi and welcome.
Hi. Thank you. Thank you so much. That was a lot about me. Thank you. I'm fascinated. And flattered. So thank you for having me today with you. And I think it's amazing because usually my first questions go off with what do you think about STIs, and stuff like that. It's amazing, Karishma, how you got to talk about the virus that we are talking on the dinner table. That's made my life so much easier in practice. I should say that because, we see so many viruses and so many STIs. And when I always used to tell people, you can have STIs for a long time. You may not know whether you have symptoms or not, and you can actually carry it and not know whether you have it or not. And you can actually transmit it to other people without knowing or without you having symptoms. And people used to be very reluctant to that information, to be honest. I always used to be challenged and they would always ask me, what? Well, how come I don't have symptoms? And they used to be very defensive. They thought I'm telling them they have something that they don't know that they have, right? And that definitely never used to go well. But with this whole corona that is happening, the understanding of, how actually a viral infection or even bacterial for that matter can actually work, everybody understands, right? So now if I go and tell people that, the coronavirus, the one that you can carry, you can give to people, you may not have symptoms and it can cause other people to have symptoms, that is exactly what your STI does. Then they are more accepting of it, then they're like, oh yeah, that's true. I'm like, exactly. It makes more sense that when we talk about corona, because now everybody seems to understand it, and because it is not sexually transmitted, they're able to accept, they're able to understand. But when I was trying to say, I mean, it was all about blame games. It was like, I don't think I have it, I never had it, the other, stuff like that. They never understood how infections or viruses or bacteria can work, and didn't want to understand as well, because it's like, oh, you're saying something sexual about me, kind of a thing, when I'm talking about STIs. But now, since the corona has come, it's just fantastic. I say all of this, and if people look at me like they don't understand, I say exactly like how the corona works,
Yeah.
Yeah. So that's easy for me now.
Yeah, it's funny also because, like, for example, I just had COVID, and I know people who just had COVID, and there's like also stigma attached talking about COVID, about like, oh my God, did I give you the virus? Did you get it from me? Like, there's like, that's a difficult conversation to have. I had to reach out to everyone I had met recently and let them know that I tested positive. And so how do you think that, the stigma that comes with testing positive with something like COVID that everyone's talking about versus
That's right.
STI, much more private, what would you say is the difference? Or like, why is there so much stigma around STI conversations?
I think the stigma around STI conversation is because we have a stigma around the word sex. And I feel like somebody wanting to have sex, or the sex itself, is for some weird reason, after we are a 7 billion world population, to be honest. And after that, it is strange how the word sex has become very shush, and people really don't want to, talk about it and stuff. I think it starts off there. And I think because sex is connected to people's morale. Are you there with me?
Yeah, I'm here.
Oh, good. Sorry.
Yeah.
Because sex is connected with people's morale most of the time. I think when we talk about sex or sex partners or having an STI, most of the time people start character judging themselves, judging each other or judging somebody's character based on somebody's sexual life. So I think that is something big that we need to really break there and start talking and telling people that when people are talking about sex or STIs or anything that's like any other infection, don't associate somebody's sex drive or sexual needs, or if they've acquired an infection, with their character. So I think the thing that we've got in our mind, where we kind of connect our character with sex, is the reason behind a big stigma that goes with talking about sex. So we have to somehow get that out of our mind, and then take it from there. So I guess that's the stigma behind the whole STI. And like I said, if something like COVID has so much, stigma, and so much, like people are actually trying to say who gave it to who, kind of a thing. Can you imagine how much will go with the STIs? So definitely there is so much stigma around STIs. I think with COVID, people also understand a concept called contact tracing, right? Which was so difficult with purely STIs in the past. It used to be, something like, I used to tell people, you need to let your partners know, you need to go and, go and get yourself tested, and ask them to go get, and they used to feel so embarrassed, and they would never do that. But if you don't contact trace, if you don't let your partners know, and if they don't get themselves, treated and tested, it's like a cycle. It's like the COVID thing, right? You give it to people, it goes around and stuff. So that seemed to be very difficult, and it's made it easy now to tell people exactly, you'll be spreading it, you might get it back again. So that's made it really good, the whole contact tracing process, because that's great. We also have contact tracing websites and stuff like that back here in Sydney, but I think that's very important everywhere, because when you're having casual sex, or even with your sexual partners, you all the time don't want to say, hey, hi, I just want to tell you I got diagnosed with chlamydia. Like, do you know what I mean? So definitely, yeah. So definitely you don't want to be doing that. So there's anonymous websites where if you put in the diagnosis, put people's mobile number, message goes to them saying, you have been exposed to chlamydia, please get yourself tested and treated. That's it. that message, and it's an anonymous message that goes like, it almost is like from the Department of Health that it is going. So yeah, so contact. Yeah, so that's a very nice way to contact trace. And like I said, because there's stigma and people don't want to talk about it, right? And all that. So we have designed different tools in which people can actually contact trace, can let other people know, can talk about it, but they don't have to disclose who they are, but they can do it in a discreet way. So I think that's fantastic, actually. Yeah, so good you brought up, like, contact tracing or talking to people about it.
So how common are STIs in India? I feel like because there's such little conversation about it, people think it just like doesn't exist, or like, oh, this is a Western concept. This happens where people are having sex all the time.
Sorry.
Oh, did you lose me?
Yes. Sorry. You're right.
Okay. So I was asking, how common are STIs in India? We don't talk about it. Hi. Are we back?
Yes, can you hear me?
Yes, I can hear you.
Okay, good. Go for it.
Okay. So how common are STIs in India?
Well, they are very common they're more common than everybody thinks it is, right? And in fact, after, I think, African countries or other countries, China and India lead the world in also HIV. So there's so much HIV around, and people really do not realize how much it is. And same with, syphilis and common STIs like gonorrhea and chlamydia. There's so much around. We just don't realize it because we don't talk about it. But I also think the problem is, you get a lot of medications over the counter, so people don't necessarily go and have testing for it. So you may miss it out in that way. But also when people go and get medications over the counter, if they say, I got this itch in my vagina, and the chemist starts giving you the whole the Caniston or antifungal creams or stuff like that, most of the things get self-treated rather than get diagnosed. So you tend to underestimate, like if you have like itch, and there is this pack of medications that's available in India. Actually, it's called Fast 3 kit. I remember this vaguely, like in my 20s. I don't know if it's still there or not. It's a great pack because it had fluconazole to treat the fungal infection. It had like metronidazole, and that will take care of all the bacterial vaginosis and stuff like that. And it also had azithromycin, which will take care of the commonest STI, chlamydia. So if people have a sexually active, or if people had any kind of symptoms down there, they went and asked people, and they would just get this Fast 3 kit and then take it all. And that will take care of whatever it is that was. So you're actually not diagnosed with the STI. So a lot of the people don't know if they have it or not, if they keep doing, this kind of over-the-counter medications and treatment and stuff like that. So I think that is what is very important, where we have to bring in a place which is very confidential, non-judgmental, and which is able to be provide people testing in a not so expensive way, especially if we are targeting like youth and young people. I mean, you can't expect them to have thousands of rupees or whatever that is. So if we try to budget it, or try to have some allowances where we can actually test them, treat them, keep some confidentiality, and also do good contact tracing. So I think that's a fantastic way of actually starting off sexual health and STI prevention. So in that way, when we're testing, we actually know how much infections are there, or what is happening and stuff like that. So in that way, we will start understanding STIs and how common it is. So to answer your questions, they are more common than people think they are, to be honest.
Mm-hmm. So you mentioned a few symptoms already, but how does one, like, what are some symptoms people should look out for? if, you know, they think they have an STI?
Look, well, I really want to emphasize saying that most STIs do not have any symptoms at all, and I won't say that's the problem. That's the nature of it, and that's very important for us to understand that most STIs don't have symptoms. So you have to kind of take responsibility for yourself. And if you're a sexually active individual, let's just say you're using condoms sometimes not, you have a regular partner or not, and things like that, you just have to make sure you go and get yourself regularly checked, at least every 6 months, have like an STI testing and and stuff like that. So that is very, very important, because a lot of the STIs don't have any symptoms. And narrowing down to symptoms, your symptoms can be a whole range of symptoms. Like for women, I think it makes it really hard, because vaginal discharge is kind of normal for women. So it's so difficult for them to actually gauge, is this abnormal or not? Because some people have increased discharge before their period, after their period, and around their period, some people are more sweaty, it gets a bit more itchy. So people are struggling to find out, is this a symptom or not, which I totally, understand. But if it is long, let's say if you're having like a large amount of discharge, and if it is itchy down there, and if it is hurting you in your tummy, especially, or inside the vagina when you're having sex, or, or you're bleeding after sex, and you're having like irregular bleeding or spotting between your periods, these are some common symptoms that, and you're sexually active, of course. And you need to definitely go and get yourself checked. So these are some very common symptoms for women. Same thing for men. You can have anywhere from between burning when you pass urination, penile discharge, soreness or redness of your testicles, and any of that can be your urethral symptoms. Again, with more men and women having anal sex, you can have anal symptoms as well, which includes anal pain while going to the toilet, or like a burning sensation again when going to the toilet. You can even have a discharge from your bum. Actually, if you're somebody who's having, anal sex, you could actually have discharge from your bum. So these are some common symptoms that people experience. But there are some bigger STIs. I would like to call it as like syphilis or HIV and things like that. And the symptoms for them can vary from a whole range of having ulcers to rash all over the body and fever, and stuff like that. So that is very, very important. So these are these are some common symptoms that you can actually look forward to. But if it is something that, if you are having sex and you're sexually active, just go and test it, independent of whether you're having symptoms or not.
Great. And hi. I don't know what happens. Yes. Okay. We're together. Great. So what are some ways we can prevent STI transmission?
Sorry, what are the ways did you say?
To prevent STI transmission.
Yeah. Sorry. So a few things. I know people are expecting me to say condoms, right? I'm going to come to that last.
Okay.
And I think we have to actually talk about a few things before. So I think having a very good knowledge is the best way to do a lot of prevention. So if you don't know what's going on, if you're not aware of how STIs are transmitted, if you're not aware of its symptoms, if you don't have aware of the risk, you're not going to be able to prevent. So I think, all the education that we guys are actually doing here, and just listening to it, asking questions, knowing things well, is actually very important in an STI prevention strategy, right? You won't be able to do anything about things that you actually don't even know. Like, so knowing and your knowledge is actually very powerful, and it is very, very important part of a prevention strategy, right? The second thing about STI prevention is probably having less number of partners, because increased number of partners, I'm not saying it's a bad thing or you will definitely get an STI, but an increased number of partners just increases your probability of getting it. Somebody with, 2 partners is probably in a less chance or less probability of of getting than having a few other partners. And the other thing that you have to think is, if you're someone who's having casual sex, again, regular testing, very, very important. And that way you prevent STI in a way that you're not spreading it because you're getting regularly tested. And last thing out of this, I would say, is condom use, of course. So condom use definitely prevents you against most STIs. 85% of the times is what I can tell you. There are some STIs which are transmitted from skin to skin contact, like herpes or warts and things like that. So you got to be really careful about it. You know, some people who use condoms 100% of the times do get very frustrated. They do get very frustrated. But I use condoms all the time. So I think, see, again, we go back to point one. Knowledge is power. Knowledge is important. So it's very important to understand that even if you use condoms all the time, sometimes there are very common viruses. It's almost like a common cold, the whole herpes virus or the wart virus, to be honest. And you just have to go and understand that that's what's happening. Don't worry about the common viruses. If you get it, go and treat it, check it out, you know, see a doctor and stuff like that. Otherwise, use a condom and keep going on. So these are some basic strategies that people can actually use to, yeah.
So I actually got a question before the talk from a story that I posted. The person asked, I've never used dental dams. Do I need to use dental? So could you talk a little bit more about dental dams and oral sex and transmission?
Great. So yes, so let's start with the basic answer. Yes, STIs can be transmitted through oral sex. So people can carry gonorrhea and chlamydia in their throat, and people can carry, you know, the herpes virus is so common, cold sore is so common in your mouth, so they can carry that virus and give it to your genital area while having oral sex. So yes, STIs can be acquired from oral sex. The second thing too is, you know, I mean, using condoms for oral sex, as much as you want to advise it, is really unpleasant. Not more for the person who's wearing it, but even for the person who's doing the oral. I think it's extremely unpleasant to, you know, suck on a rubber. So I don't think most people, hardly anybody, uses condoms for oral sex. Which is a bit of a worry, because especially if you're working in a sex industry, or if you're seeing large number of partners, or if you tend to have a large number of partners, the chance that you're going to have STI in your throat is more likely, and that is the truth. And if it is unpleasant, and if people are not willing to use, which I get it, right? It's not pleasant at all. So there is a risk of transmission through oral sex, and especially higher number of partners, depending on what work they're doing, especially the sex workers, the chances are very high that they're carrying STIs in the throat. Dental dam is, again, dental dams is something that, you know, sex workers use at work all the time, also because of the large load of people that they see. And I said the chance that they can get an STI from the vaginal discharge or from the anal, you know, things. So, but what is so important about dental dams is it's not just so the person, if they have oral herpes, it's not just that they are giving oral herpes to other people's genital bit, but even if other people have things in the genital area and discharge and stuff like that, you can prevent it from happening. Dental dams is nothing but it's a condom. It's like a rubber, like the one that we see in the same material, but it is just a piece of square, like a handkerchief kind of thing. And people can actually drape it over the vagina and go down when they're having vaginal sex. They can also use it for anal area for oral sex. And again, to be honest, it is best if you're having a lot of partners to use both condoms and dental dams for oral sex. But honestly, people hesitate to do it, but I think we have to weigh risk over pleasure, or pleasure over risk, right? So yes, you want to have the pleasure, but what's your risk of getting STIs and stuff like that? So if you're having a lot of sex and you see, you know, a lot of people, I think it's a fantastic idea to use dental dams. And dental dams are just like condoms. Like I said, you put it on people, and yeah. And
so I think something that scares a lot of people about STIs is that, you know, some of them don't have a cure per se. And, you know, herpes, HIV, HPV, you know, there's a few of them. So could you talk a little bit more about that? Like, is this something to be scared of? Yeah.
Okay, so I'm going to start off with this herpes thing, right? Like I've made this video where I say I spend so much time counseling more than giving the tablet itself, and so hard. So I think that's very important to know. But again, letting you it's like before though. People have had herpes for centuries, right? And people have had this herpes, and your grandparents and all people, they always have cold sores, and they kiss babies and stuff like that, and they always transmit it to children. This cold sore thing, this whole like for example, chicken pox, right? We get chicken pox as a child, and nowadays if you don't get it, you go and get yourself vaccinated to get chicken pox, and you get the antibodies. And the concept behind chickenpox is once you get it, the virus never goes out of your system. It always stays in your spinal nerves. And when your immunity goes down, or when you're feeling a bit low, this virus can come back again on the outside as shingles or herpes zoster, we call it. So it is not some, and this has been again around for such a long time. And so this concept of having a virus that you can carry in your system that may not show any symptoms when it's dormant and sitting in, and when your immune system is down, sometimes it can come out and show symptoms. That concept has actually been around for so long. It's amazing how the minute the word sexually transmitted comes in, everything becomes so difficult. Understanding becomes difficult, accepting becomes difficult, and you're thinking, you got chicken pox, you're going to carry it for the rest of your life, it's going to come, it's the exact same thing, what's the deal? So it's again, yeah. So the bottom line is we are so used to carrying viruses in our system dormant, with vaccinations, or with the chickenpox itself or the herpes itself. We've been doing this for a long time. There's nothing to really freak out about it right now. What's all the big deal about, oh, you cannot get rid of the virus? Oh yeah, that's been going on forever. So what's all the talk about? The whole concept is because it's sexually transmitted, isn't it? What's the big deal? Once you start accepting, sex is human need and people are having it, I don't think it'll be so hard.
Right.
Okay, so that's herpes for you. And like with HPV, it's very similar to herpes. It's from skin to skin contact, but you can get rid of it. I won't say people can never get rid of it, right? But sometimes, like, it can be dormant for a very long time, and then people can have symptoms. Or sometimes people can not have symptoms for years and years after the first time they've had symptoms, but then suddenly, during pregnancy, or when the immune system is going down for some weird reason, that's when they actually show symptoms. So that can happen with HPV, and the body's immune system sometimes can get rid of it completely, and it's not really necessary that you need to actually carry it for the rest of your life. And coming to the big virus, which is the HIV, which, I really want to tell you, with the amount of research that's going around, HIV is actually not a bad thing to have at all anymore. So it's not a death sentence. Nobody is dying, because the medication that is available for HIV is down to 1 tablet once a day. People used to take 8 to 12 tablets daily with so much side effect. And, you'll have all the fat loss and muscle loss, and people will look like that, and nothing. These drugs do none of that. They're just such fantastic drugs that are actually available. 1 pill once a day. Some people, these days with all this health awareness and, macho bodies, people are popping pills and vitamins and so many. 1 tablet once a day would do nothing with such minimal side effects. And once you're on treatment, the medication brings your virus in your body to less than, overall body, it brings it less than 20 virus for the whole body. Okay.
Oh,
wow. We call it an undetectable state, which means your new machines actually cannot detect the virus at all. So it's an undetectable. So when you're running it through the new machine to see how much virus people have, and she says it's less than 20, who knows, it can be 2, it can be 3, but it's undetectable. So you're able to bring the virus to undetectable, which means people are not going to get really unwell. They are not going to get AIDS. So when we say HIV, people associate HIV with AIDS and they think they're going to die, right? That doesn't
Right.
happen. Yeah, that doesn't happen anymore. So now HIV's definition has changed, and HIV is more a chronic illness. That's what we would like to call it, rather than death sentence. So if you go and get tested, if you go and get treated, and you have a control over your virus, and you work on your lifestyle, then it's fantastic. Nobody should, with all these interventions and recent stuff, be dying at all. So you're right. So with all the STI, so again, the whole thing about HIV now is the whole sexually related transmission that it could have happened through, to be honest. People have diabetes, people have hypertension, and people have cholesterol and take one tablet or even more than one tablet and injections for the rest of their life. They're not sulking. They don't feel
Right.
embarrassed. You know what I mean? Actually, to control somebody's diabetes or control somebody's cholesterol is so much more harder than to control somebody's HIV virus. With the pills, to control somebody's HIV virus is so easy. It's so easy when compared to how much effort we actually put into controlling somebody's diabetes or hypertension, to be honest.
Right.
Yeah, so there's so much advancement in sexual health, and yeah.
Yeah, sorry, I didn't mean to cut you off, but
No. It's all right.
yeah. So say someone does test positive. A lot of times, like, there's that fear that that is the end of all sexual relations. But that's not true. A lot of people who have tested positive for a lot of different things still continue to have a healthy sexual life. So
Yeah.
how would you going about that? And also, like, could you touch upon the mental health aspect of that, of living with a positive diagnosis?
Right. Look, I mean, most STIs are curable. Like, they're gone. So people need a lot of counseling around STIs, and that's very, very important, especially for the stigma that's associated with it. People like freak out. You're right. Lot of the times it takes a long time, especially after your diagnosis of a first STI. It takes a long time for somebody to rescue, their sexual life. So counseling is a very, very important part of sexual health. And I also have seen that if it's stuff like gonorrhea or chlamydia, where you can give a pill or an injection and actually treat it completely, it's a little bit better. Like you said, when it comes to long-term things, when you say the word that you might have it for the rest of your life, the minute you say that, people are just, shattered and falling apart. So in that case, there is guilt, there is anger. Who gave this to me? And then, there's so much mental health that we actually counsel, and we actually have to deal with diagnosis of an STI, which is going to actually remain for a longer time than the STIs that is, comes and, we treat it and it's gone, and, and stuff like that. So that's something that is very important. Counseling is very, very important aspect of doing that. And we should definitely encourage them to go and have, sex or sexual partners. We also talk a lot about disclosures, right? I mean, if it's gonorrhea and chlamydia, like I said, you don't have to disclose to your future partners. You need to get treated, not have sex for 7 days, and you're actually good to go. But what you need to do, yeah, that's right. And you're actually good to go. And what you need to do, though, is to disclose to your previous partners, because you clearly got it from someone, and you want them to go and get tested. And if you're someone who regularly dating, let's say you have a few regular partners that you're having sex with, then it's hard to say, and then you're all giving it to each other, and that goes around. So that is very important, to go retrospective and say. And that's when it makes it easy, when you have media and system which can be done discreetly, rather than them having to go and tell to each partner, right? And when it comes to future disclosures, actually, like in Australia and some other countries as well, the law has changed on the basis of disclosure of HIV. So if you're somebody who's been diagnosed with HIV and you're taking your medications regularly, and you have an undetectable viral load, that is less than 20, because HIV people have to regularly go and see their doctors, get their medications, get blood tests and stuff like that. So if you're responsibly doing that and you don't have a detectable virus, you actually do not have to disclose that you have HIV, because you're definitely not transmitting it.
Right.
So with an undetectable viral load, you are not transmitting HIV. So you don't have to actually disclose if you're doing that. And because you're able to do that, people are able to get married to women who are HIV negative and have unprotected sex with them and not give them HIV. And they're also able to have babies, and the women conceive and the babies are all negative because this person's HIV is undetectable. So
Mm-hmm.
it's amazing in that way how far this disclosure with HIV has gone. It's very tricky with things like HPV and herpes. It's a very controversial topic. It's very frustrating for somebody who's got the herpes because on their point they should say, you should have told me. You should have told me you have it, right? But honestly, the science behind it is a lot of the people can have it and not know that they are having it. And if they transmit it like that, well, we can't do much about it. But I do understand that some people make use of that science, take that science for their advantage. They might know they have it, but they can, once you're educated, once all this information is out, some people use it and say, well, I don't know I have it, it's not me, it's you, and things like that. So that does happen. So the bottom line is, Karishma, I think counseling is very important, and having correct knowledge of your STIs and being thorough and being able to be one of those doctors or one of those clinicians who's able to provide that for people is very important. So that's something that we need to develop in the due course, and that's something what our people need actually.
Right.
Mm-hmm.
So, the other question I have is, well, it's kind of two-sided. So one, is it possible to get an STI through not sex, through something else? And because I feel like there are some ideas about that out there. And then the second question is, if someone is in a long-term monogamous partnership like marriage, do they still need to get tested?
Good. I think they are good questions. So I'm gonna go off with the first question that you
Okay.
asked me. I can say the answer is no. But I can only say it with very little confidence. See, the science behind STIs over surfaces and over substance is these, any like virus or bacteria, they tend to actually die, right?
Mm-hmm.
However, on saying that, there has been, rare cases and rare custodies, and you'll see it in a lot of sexual assault when people are going to court and stuff like that, child abuse and child sexual assault, they come up with all kind of things like, we use the same towel, it could have been in the towel and stuff like that. And very rarely, and unfortunately, people do get away with it because if it's wet discharge and if somehow the discharge has gone into the person and stuff like that, very, very rarely, very, most of the time, people use that as an excuse to get out of, things. 98% of the times, it is sexually transmitted. Getting off people's bed or linen or toilet seat is really, really very rare, very unlikely. Right, so that's your answer to the first question. So the second, sorry, I just really want to tell Lala, I want to answer this question. Lala, you cannot get it from a public toilet. No, that's not possible.
In COVID terms, surface transmission not possible. Basically,
yes,
that
exactly.
yeah,
Look how easy it's become, right?
right.
You can tell it to people, and now they got this sorted. They got it all understanding.
Everyone good.
Yeah, absolutely. And yeah, so that's that. Sorry, what was your second question? Sorry, there was a...
Yeah, my second question was, like, when someone's in a long-term monogamous partnership like marriage, for example, do people still need to get tested?
Yes, yeah. Okay, so look, I mean, it's a very tricky question, right? I mean, marriage it's a difficult question because it's all about trust, right? It's all about trust, whether it's between a gay couple or whether it's between a heterosexual couple. Marriage is all about trust, and I totally get it. I think it comes, I mean, you don't people usually in a regular monogamous relationship like marriage, they do not get tested, right? But again, I think if you feel like the marriage is, falling apart, or if there has been a bit of a distance and you're suspecting something, or you are having symptoms, I mean, go and get yourself tested in a situation like that when you're in a, when you're in a long-term relationship. Again, I mean, marriage does not necessarily mean long-term relationship. People can be unmarried and still be on long-term relationship. Again, if you're unmarried, long-term relationship, everything is going fine, the trust is good, everything is good, great. But when you feel like there is a bit of a tension, you feel like, I'm not sure, go with your gut feeling at that point. Go and get tested. It wouldn't hurt you. You can go and get tested and feel like, we're having a lot of fight. We really haven't had sex for a long time. What's going on? I'm worried. Go and get tested. It wouldn't hurt. Look, I mean, I don't mean to talk about any particular group as promiscuous or not, but, in Sydney, I'm just going to say that, we do tend to talk to some gay men who are still in long-term relationships. They also talk about open relationships. So if you're in a monogamous long-term relationship where only this partner and that partner are having unprotected sex, let's say, but an open relationship also means that the other partner can have sex with other people and this partner can have sex with other people as well. In that situation, if it's an open relationship, even if you are in a long-term relationship, then you have to go and get yourself regularly tested and do the right thing anyway.
Right. That makes sense. Great. And then I guess one last question I have before we move to the comments. There's a lot of talk about whether pubic hair affects whether someone can get STIs or is more susceptible to STIs. So I've heard that. So the answer is no. So I guess the answer is, I guess the question is, some people say shaving or waxing can cause like small cuts or tears, which can make you more susceptible to STI transmission. True or false? I guess that's my question.
It's a good question though, but I think small cuts and small bleeding can make it more transmissible to skin contact viruses and stuff like that. You could be right, but honestly, pubic hair is a personal choice. People do not have to remove it worrying about is something going to sit around in that area, and is it actually going to go in and stuff like that. But no, that's all no. You can have pubic hair, you can have it less, you can have it more. If you feel like waxing, you can get waxed. Laser is amazing these days. You want to get a laser, you want to get it all taken off, it's all a personal choice, honestly. It doesn't have anything to do with increasing your risk of having STIs or decreasing your risk of having STIs just because it's all clean there. No. When I say clean, not clean as in unhygienic, clean as in cleanly bald without any hair. Because I don't want people to now pick on the word clean and then completely water wash the whole area. And they said, the doctor said clean. I said, no, that's not the clean. But it's more like a clean shave kind of a thing that I'm talking about. So clean is
yeah. Okay, great. So let's move into the audience questions now.
Perfect. Yep.
Yeah. So if you're watching right now and you have questions that have come up, if you haven't asked them already, now is a good time to drop them into the comments. And I'm gonna quickly scroll through and see if there's anything we missed. I tried to work some of them in.
Sure. There was something about contact. Okay.
Yeah. So there's a question, why is contact tracing important?
That's right. So I think I've kind of covered that question now. Like I said, it's like this popular song, what goes around comes around. And that is why contact tracing is very, very important, because if you're not going to tell your partners, if people are not getting treated and you're with the same bunch of girls or guys and you're going to have sex, end up having casual sex, whatever it is, if you're not doing it, it's going to come back to you. So that is why contact tracing is very, very important, so that first it doesn't spread to more people and eventually it doesn't come back to you again. And it's also important because STIs can be asymptomatic and people may not know it for a very long time. And some of them having or carrying an STI for a very long time can end up with side effects like pelvic inflammatory disease or even infertility. Some STIs can cause. So it's very important to actually let people know that, look, I feel like, I mean, you've been exposed to this. So go and get yourself treated and tested. Actually, if anybody is very IT, a good company that, you know, invests on this kind of an SMS, you know, system, which anonymously, you know, tells people or contact trace, I think it's a fantastic, that'll make money.
Yeah. Anyone watching, please take that into consideration. So the next question is, can you get an STI from non-penetrative sex? I know we talked about this a little bit, but you could touch upon it.
Yes, I'm going to say yes. You can get STI from non-penetrative sex. So I know when we talk about non-penetrative sex, people are just thinking about oral sex, which we have already covered a bit today about oral sex. I also want to say non-penetrative sex can include foreplay, which is also very, very important. And, you know, and foreplay can involve a lot of saliva, a lot of your hand, you know, a lot of touching, a lot of kissing, and a lot of things. So during your foreplay, the transmission of STIs can actually happen. So there are studies where people have said we have absolutely no anal sex at all. And when you test their, like, do bum swabs and stuff like that, they have tested positive for chlamydia, gonorrhea in their bum. And that is based on the fact that, you know, there is fingering, there is rimming, there's a lot of saliva and body fluids, and all this is involved during sex. You know, it's not a straight in and out situation. So considering that, you can get STIs from, you know, even foreplay and all of that being involved. So, and like I said, skin to skin contact, even before penetration, HPV, herpes, all of this can be spread from, you know, skin to skin contact. So yes, so there's a whole other way which people can get. But I think bottom line is it involves some kind of a sexual act. It doesn't have to be penetrative, but like I said, it can be oral, it can be foreplay, it can be anything else, but it has to involve a sexual act.
Can we say that if sexual fluids are involved, that's a good way?
What fluids?
Sexual fluids? Like
yes, that's what I'm saying. Yeah. You know, so
okay.
That's what I think dental dam also we were talking about. So vaginal fluids are involved, you know, or anal, or even your pre-cum, all that is involved. They're all fluids. And if they're carrying some STIs, yes, there is a good chance you could, you know, get it.
Right. So then we have another question. Can we just walk into a regular clinic in India and get tested?
Unfortunately, I'm not in a situation to answer that because I don't practice in India, but that is because that is my aim in wanting to do it. Anybody should be able to walk into a clinic and get some kind of confidential service and get a service without judgment and get these tests done. This is very, very important, but we are very far away from that service that's going to happen in India. But what I would like to say is there are a whole bunch of people who do these tests. I think dermatologists are trained sexual health physicians usually. So you can go to a dermatologist and they can do a test. Obstetrics and gynecologists, I know women go, but they are actually skilled in sexual health medicine. So they will be able to test you for STIs. You can go to even infectious disease specialists. A lot of the time, infectious disease specialists also know about STIs and they can screen you for STIs as well. So there are a whole so unfortunately, I think no particular person is practicing, you know, just venereology as such, but people are mixed because venereology qualification a lot of the time is mixed with derm in India. So we have a lot of dermatologists, a lot of obstetrics gynecologists and infectious diseases people can actually do STI tests. There might be some, you know, general practitioners also who are doing, you know, STI testing, but like I said, I'm not aware of it. I leave it to anybody else who can actually find out and out there, and you can put it out for you.
Right. I also came across a couple of organizations. There's one called Better to Know, where they write to like the number 2. And they seem to have a number of branches all over India. So something like that can also be like a non-judgmental space to go to for
but
testing.
When we Google Better to Know, if it is a sexual health clinic, when people are going inside Better to Know, how how is that non-stigmatizing or providing confidential service?
Right, that's a good question. I think I would have to try them out. I don't know how else one could actually know that.
No, it's perfect.
Yeah.
It's perfect to have sexual health clinics. I mean, we all work in sexual health clinics here, but none of the sexual health clinics are actually placed on main roads or main hospitals or
Oh,
big.
you mean physically, the experience of going to a clinic?
Physically the experience. Like you can't say,
Yeah.
come to me or whatever that is, and then say sexual health clinic, and then people walking in, walking out, your advertising banner in the front. Do you know what I mean?
Yeah.
So,
Yeah.
so I it's a question. I don't know. I'm just asking because here we are very discreet about it. It's always in a corner street or it's always in the back room of a big hospital. It's done very discreetly. Sexual health clinics, really. It's not really a big board that is there at all. We do it very discreet and very confidential, to be honest. So I'm just curious, that's all, because it's amazing. If people are doing this, that's fantastic. And I'm just curious to see how this goes.
That's a good question. Definitely worth looking into and research a little bit. And then I think I have one last question in the comments.
Yes.
It's how far back into the past must you go with contact tracing?
Perfect. So some infections you have to go as back as only 3 months. So for gonorrhea and chlamydia, we can go as back as 3 months. Some infections we have to go as back as a year or year and a half, like for HIV. We usually tend to go for, at least we push it to as far as 1.5 to 2 years in terms of HIV contact tracing. We go that far because sometimes if people are not regularly testing, their immune system can be absolutely strong. You might have had it for years and years and have had no idea. So we tend to go really far back. And with syphilis as well, again, you could have it for a long time and not know it. We contact trace for as far as 2 years. So for different STIs, contact tracing is different. And like I told you, with herpes and warts, we don't even bother. It's not something that you need to or want to contact trace because, like I said, you can't. People are going to say, I don't know I have it. And you can't go as far as back as whatever that is. You know what I mean? Yes. So it varies from one STI to another.
Okay, great. I think that's it from the comments.
Perfect.
Is there anything that we haven't asked yet that you have to say to us?
Look, I mean, in the midst of all this, I just quickly want to say contraception is important.
Yes.
And I think I don't want to go there today because that could be like another hour session.
Right.
So if you're not ready to have a baby, contraception is definitely so worth it, so much better than abortions and terminations and stress and pain and the money involved and all of that. It's just very traumatic to get terminations. So definitely, if you're sexually active, please go and see someone, get some great contraceptions. And that's, again, very important part of sexual health and, safe sex and prevention. So that's something that we didn't really talk much about today, but maybe we'll do it another time. And so that's that.
Great. Thank you so much.
Pleasure.
All this information with us. And sorry about the late start again.
Oh, no, it's all right. That's perfectly fine. It just gave me an opportunity to actually go live and see if people are actually coming to actually say hello, which was great. It was nice to know that people just came, even to, there was no host, but I said, oh, okay, that's good.
Right. You've got the information. We're here to listen. So
great.
And
Pleasure.
thank you for all of this information.
Pleasure. Thank you so much for having me, Karishma, and you're doing a great job. This is a fantastic initiative. More people should do it. We should spread the knowledge a little bit more. India is a big country, so we just have to keep going.
Yes, thank you so much. And hope you have a lovely rest of your night.
Thank you.
All right.
You too. Take care. Bye.
Bye.